Good morning or good afternoon, everyone. Thanks for joining this special focus dialogue today. This is Alessandro from UICC. Today, we'll have the pleasure to have our friends and colleagues from the City Cancer Challenge Foundation telling a bit more about their work to build city readiness to improve access to quality cancer care, and about their upcoming campaign, The City of Tomorrow. As you all know, you'll know the rules for Zoom. Just feel free to keep your video on so we can see your smiling faces from across the world, and keep your microphone closed for the moment so we can hear the presentations. You can switch on the chat box and feel free to add any comments or questions as they come up while our friend Sikan will do some presentation, and we'll have some time after that for some questions and answer. It will be a very conversational, hopefully very insightful session today. So without taking too much of the time, I'd like to introduce Rebecca Morton-Doherty from City Cancer Challenge Foundation, who will start the presentation.
Hi, good morning, good afternoon, everyone. So we're going to run this dialogue in two parts. I will kick things off with a very brief introduction to the City Cancer Challenge, who we are, what we do, and what it really means for a city to become part of the CCAN community. And then we'll pause for a couple of questions, and then I will hand over to my colleague, Beatrice Escrina, who's our head of communications, and who will introduce the campaign, The City of Tomorrow, and the application process that's opening very soon, which we're very excited about, and talk to you a little bit more through that process. So next slide, please, Bea. So the City Cancer Challenge was launched by UICC in 2017 at the World Economic Forum annual meeting in Davos. And 2 years later, as the program continued to expand, CCAN transitioned into a separate standalone organization, but still maintaining very close ties with UICC and its members, and of course our colleagues who we have on the call as well today. So our vision at CCAN is a world with quality and equitable cancer care for all. And the way that we aim to do that through our mission is supporting cities around the world as they work to improve access to equitable quality cancer care. And I just want to stress on that point that City Cancer Challenge is very much a city-led and city-driven process. And we see ourselves very much as supporters and facilitators of that process. So this is a snapshot of the cities that we're working in today. So we're currently active in 9 cities across Africa, Asia, Latin America, and Eastern Europe. And for those who are interested in specific cities and activities, we can perhaps share some links to additional resources and stories after the dialogue. And next slide, please. So I want to spend a little bit of time just on this slide, which is to talk through what it really means when a city joins CCAN. And so this is a visual of what we call our model, or our sort of 7-phase engagement process, which starts with due diligence. And this period of due diligence, and Bea will talk a little bit more about that because it's an important part of the application process, is really for CCAN to assess and understand whether we can bring value to a city and its ongoing efforts to improve cancer care. And once a city has been officially accepted and launched, we move to what we call stakeholder engagement. And this is probably one of the most critical and difficult parts of the process. This is about mapping out who are the key decision makers and influencers in the delivery and resourcing of cancer care services in a city from across all sectors. So we're looking at healthcare providers, government at local, regional, and national level, civil society, academia, professional associations, industry, And I have to stress that in all of our current cities, the local UICC members have been critical in helping us to understand the cancer care landscape and helping us to identify, engage those stakeholders, and most importantly, in helping us build a culture of trust and transparency between a group that often hasn't worked together and may not want to work together all of the time. But once we've identified who needs to be involved, we need to work together to identify what are the key gaps and challenges in cancer care. What are the bottlenecks to delivering quality cancer care to patients? And we know that you as patient groups, cancer societies, you know what many of those challenges are because you're living them every day and you're best placed to perceive what those challenges are. And what we're trying to do through City Cancer Challenge is to support you and those other stakeholders across sectors to reach consensus on what are the priority gaps and challenges. What do we need to address first? Because we know that we can't do everything. Resources are limited, but where do we start? And it's to support the city's group of stakeholders to make those decisions based on robust citywide data. And that's why an important part of the City Cancer Challenge process is collecting data from across institutions in the city, from civil society, and also the patient perspective to get a real understanding of what is the capacity in terms of infrastructure, equipment, services, human resources, quality, management of core cancer care services. And then working with the city to interpret, analyze that data, and come to consensus around what are really the key bottlenecks. Once there is that consensus on the 6 to 8 priority gaps, and they could be in pathology, radiotherapy, standardized reporting, what City Cancer Challenge then does is to mobilize our network of over 60 technical assistance partners to work with cities to start developing project plans to address each of those gaps. And if you look on this visual, what you'll see is that at the moment we have 2 of our cities, our newest cities, Leon and Greater Petaling. And I think I saw in a flash before the slides came up that we've got Professor Aisha from the University of Malaya, who's been working very closely with us in driving the process in Greater Petaling. So they're now in the stakeholder engagement phase and about to move into the needs assessment. And then we have our 7 other cities, Cali, Asuncion, Kigali, Yangon, Kumasi, Tbilisi, Porto Alegre, all implementing. So they've gone through that hard process of the needs assessment. They've identified where the gaps are. They've worked with local experts and global and regional experts to come up with action plans for those key projects. And they've started implementing. So in some cases, the projects have already been completed within a 2 to 3 year period. There are other projects that are still ongoing. And you'll see that we've got 3 cities here that we've moved through to what we call sustainability. And what that means is that those 3 cities who started with us in 2017, they've now transitioned so that most of the projects are now being coordinated, overseen, led by 1 or more local sustainability partners. And that's really the objective, is that the work that we do, the projects that are launched, that they're sustainable and that they are city-led and owned. And that's why we put so much emphasis on that piece. And also that this sustainability thinking comes in right from the very beginning. So right from when we're engaging stakeholders, we're already thinking about how do we ensure that this process is sustainable? And that's why we also put a lot of emphasis on local capacity building, on looking at the local policy environment, and again, a close collaboration here with many of the UICC members who are often behind driving those policy changes and making sure that there is alignment with the activities. So this is just a snapshot of some of the types of projects that we've been delivering in cities, and we've mapped these against the 6 health system strengthening pillars. So just to pull out a couple of examples, whilst every city is unique and every city identifies their own set of priorities, develops their own projects, we're starting to see now across the 7 cities where we've gone through this very intensive process there are some common trends and themes. So palliative care, for example, is something that's recurring across all the cities. The need for improved multidisciplinary treatment planning and care delivery, that's something, again, that's been recurring. And so what we've done across those 7 cities is work very closely with ASGO to develop a very comprehensive technical assistance package for multidisciplinary care. So developing guidelines, trainings, etc. And then here you've got a couple of other examples of areas where we've been developing those kinds of support packages for cities. Next slide, please, Bea. And this is just really to highlight a couple of success stories so far and to share what some of our reach has been. So I mentioned that, you know, each city develops between 6 and 8 projects. We currently, as CCAN, have 71 active projects happening across our various cities, again, across different areas in pathology, radiotherapy, multidisciplinary care. Through that process, we've engaged over 1,200 healthcare professionals and over 125 different organizations. So I think that's just really to say that the City Cancer Challenge process is inclusive, and it's really striving to engage people that are working on the ground. And we want that process to be as representative as possible and to be multi-sectoral. And so this is really just to illustrate what we're trying to do through that process by engaging these different groups of actors. And I wanted to share just one specific story from a city just to give you a sense of how it works. So this is Cali. This was our first city to join the City Cancer Challenge process in 2017. So the city went through the needs assessment process. One of the critical priorities that was identified in Cali was the need to strengthen IHC. And so local pathologists worked to collect data to identify that need. And then we engaged ASCP, which is the American Society for Clinical Pathology, to work with local experts to take a deeper dive to really understand what the need was. ASCP then ran a series of workshops with 28 local pathology labs and 67 professionals. And as a result of that, a new set of quality control guidance manuals were developed. And at the university hospital, the Hospital Universidad del Valle, then as a result of that, decided to invest in establishing an IHC lab and also in bringing on board new human resources. And over time now, because we've been active for 3 years, we've been able to track some of the early progress and impact of that project in Cali. And that is that the university has been able to reduce the turnaround time from 2 weeks to 8 days. That was from 2018 to 2019, and to increase by 67% histopathology tests being carried out at the lab. So already some concrete results. And this is one example of one project in one city, but just to give you a sense of how that flow works. So from identifying a need to bringing on board some of our global and local partners and translating that into concrete action at the city level. So I'm going to pause there. That's a very whistle-stop tour of City Cancer Challenge, of what we do and why we work, and just give an opportunity if there are any questions at this stage about CCAN, I'm happy to answer before we move on to Bea, who will talk very specifically about the upcoming call for applications for new cities. Silence.
Maybe I have a quick question for you, Rebecca. It's Alessandra here from UICC, just to get the floor warmed up a little bit. Have you noticed sort of the conditions when sort of action at city level have driven then sort of policy change at national level? It sort of almost works as a traction for the whole country, just to understand how cities might sometimes really act as a lead for the national change.
Yeah, that's a great question, Alessandro. I think what we found in the cities where we've worked so far is that CCAN, by playing the role of a neutral convener and sometimes bringing together groups, as I said, that may not necessarily have worked together before or maybe didn't feel comfortable in that space, because remembering that depending on the city, we have very different cancer care contexts where you have both public, private institutions delivering cancer care, often in competition with each other. And so by bringing these groups together, you know, we have a great example in Asuncion where we brought together those different stakeholders and created what we call a city executive committee. And that's something that we do in all of the cities we work in. So we identify key decision makers from civil society, government, from private and public healthcare institutions, and bring them together in a committee that then really oversees and drives the process. In the case of Asuncion, by nature of this group coming together, they decided that one of the priorities beyond the sort of infrastructure equipment was that there needed to be a cancer law in place to really anchor some of these changes. And as a group, they reinvigorated a process that had started several years before to develop a cancer law, which they hadn't managed to pass. But through the sort of impetus of City Cancer Challenge and the work happening in Asuncion, it sort of brought a new spotlight to the issue. And as a result, in 2019, they were able to work together to have that law reviewed by the Senate and subsequently passed. And what's happened since then is that that group that started as a City Cancer Challenge sort of advisory group or committee has now transitioned into being a national advisory body on cancer control. So it's a really nice example of how some of those city activities can get traction and then can actually bring things up to a national level.
Thank you. I just noticed a question from, it was actually sent to me privately, so from Bambo Fatai, and let me know if this is something that Beatrice might address. Is there any specific criteria in selection of cities for City Cancer Challenge?
Yeah, so maybe we can park that one because Bea will talk through that in the next part of the presentation. Thank you for the question though. Good. Well, what we can do is we can shift over to Bea to talk through the application process, and then if other questions come up throughout, then I'm happy to jump in and respond to those at the end as well.
Thank you, Rebecca. Can you see my screen well? Perfect. Thank you so much. I think I see someone on the waiting room. Perhaps we should admit Sefedin before we start. So excellent. So thank you very much for joining us today. My name is Beatriz and I run communications at City Cancer Challenge. And we would like to introduce you to the City of Tomorrow campaign. And in doing so, I want to invite you to watch a very short video about the City of Tomorrow. Instead of me playing the video, I'm going to ask Alessandro to share with you via the chat a link so you can all watch it now together via your own laptops or computers, because I think that the sound and the imagery will be much nicer if you play it on your computers. Alessandro, can you please share the link with them?
I just shared it in the chat box, so please make sure if you've watched the video that your microphone is muted.
Yes, so let's all watch the video and I'll go back to you in a minute. So welcome to the city of tomorrow. I want to believe that the video should have concluded by now. So I want to start by sharing that back in February on World Cancer Day, we launched the City of Tomorrow global campaign to inspire cities, especially in low and middle income countries, to join us in tackling the world's growing cancer burden. And with this campaign, we wanted to mobilize people like you, individuals, groups, organizations, institutions, what we call our dreamers, who share our commitment to improving access to quality cancer care around the world, and who will want to support us and support cities on the journey to becoming the city of tomorrow. But you may be wondering, what do we mean by the city of tomorrow? And it's very difficult to explain because it's an inspirational concept. When we were thinking about the city of tomorrow, we wanted to translate an idea, an aspiration, into something that was reachable and material. A journey to the best tomorrow possible when it comes to cancer diagnosis, treatment, and care. So yes, it's aspirational, but it's close to all of us. It's a campaign which encompasses the past that already exists, the present that for us means new opportunities moving forward, and the future that is a long-term vision that will definitely go hand by hand with the vision of City Cancer Challenge overall. It's a global aspiration for sure, reflecting the fact that cancer touches everyone no matter where they live. So I see here people, I see here hope, and I see here a common vision to tackle cancer care that, as I'm pretty sure everyone in the room knows, it causes 9.6 million deaths a year. Before going into more operational aspects of the campaign, and perhaps some questions that you have as civil society organizations, I want also to build on what Rebecca was saying before, that the City of Tomorrow campaign is built on our experience working around the world, designing, planning, and implementing local cancer care solutions. And it's key that we don't forget the word local, because everything that we do is bottom up and is city-led. So for us, the local component is critical. Without that, our model and our vision and mission wouldn't be able to succeed. And I'm going to repeat myself again, but it's a campaign motivated by the need to improve access to quality to cancer care. Because sometimes it's the lack of access, but sometimes it's not just the access, it's the quality to treatment and diagnosis and care overall. So Rebecca was saying that the application opening was around the corner, and it's true. The application process will officially open on October 21st. So the clock is ticking. We speak about, instead of like a countdown, we were using the concept count forward. So we started the clock on the 4th of February, and it was moving forward to this particular date. Eventually, the launch was planned for World Cancer Congress in Oman, but since the Congress was called off because of the current pandemic, the current circumstances, we still wanted to devote it that time for the opening. What else? So questions that you may have right now is like, can any city join second? And yes and no. I mean, there are minimum of requirements that your city should meet. And the first one is that you should have a population of 1 million people, okay? No matter where you are, it could be Asia, it could be Latin America, it could be Europe, but your city, if you're willing to apply, it will need to have above 1 million people. Another aspect that is key, and that's why we really like to work hand by hand with UICC and UICC members, is that applications must be submitted by one or more civil society organizations. The application process has 2 steps. The first one is an expression of interest, and those organizations or applications that passed the first cut will be invited to submit a full application form. But the first phase, the expression of interest, must be submitted by one or more civil society organizations together. So if you're willing, if you're interested in bringing your city forward, but you know that perhaps there are other organizations or like-minded organizations in the city that will have the same interest, we really encourage you to join forces and submit and join application. There was a previous question around criteria, right? And every application is assessed against a set of criteria. And those criteria are reflected on the city checklist that we'll be more than happy to share with you after the webinar, but you can also find it right now on our website. And the checklist and the application is subject to a very solid and robust due diligence process. So we do fact check, we do cross check every single thing, because there has to be a level of readiness in a given city for us to start working with them. Otherwise, the second way, the second model, we won't be able to succeed. So is your city ready to take on the City Cancer Challenge? So this checklist was designed to help you assess your city readiness, right? As well as to identify ways you can strengthen your own application. You might realize by going through the checklist that you meet a number of requirements, but one of the cancer pillars or one of the aspects, for instance, the Cancer Care Foundations, you still need to improve a little bit. So perhaps you don't want to apply on this next call for applications, while the following one, don't forget, this is not the last call for applications, this is just the next one. So we will be launching more calls in the next future. So please ensure you carefully go through the SICAM checklist. Don't worry, you won't be left alone while filling out your application form. We have developed an online tool with like a how to apply manual. It's very user friendly. And if you get lost in translation, you can always contact us and we will try to guide you through. But please go through the checklist to ensure that at least you meet the minimum requirements, to ensure that there is a city readiness that will definitely have an impact in the medium and long term on the city. So what are those drivers of success and sustainability efforts that we are referring to? So we talk about local leadership and political commitment. There has to be a political will for sure. Partnerships, we work with both the public and the private sector together with the civil society. Rebecca was referring to the city executive committees that are formed in its city, and it's the voice of cancer in that particular city. So we gather together public hospitals, public labs, private ones, academia, the government at different levels, depending on how fragmented the health system is in that particular city. And super important, the voice of the patient is always represented in our city executive committees. It is crucial that the voice of the patient is embedded in the process from day one, okay? So we need to ensure that everyone is willing to work together and to ensure we all improve when it comes to access to quality cancer treatment and care. People-centered approach, I already mentioned that the patient is a key element and it's at the center of everything that we do, because at the end, what we want to achieve is to improve patient outcomes. Enabling policy environment, also critical together with Cancer Care Foundations. But don't worry, You see a photo on the left side of the checklist, but again, we will make everything available to you if you don't have it already. How can you support a city application? You might be wondering right now, right? Like, okay, I want to do this, how I can ensure my city is up there, it's running to get a spot on the City Cancer Challenge. Well, we invite you to introduce the City of Tomorrow campaign in your respective cities and to reach out to local civil society organizations. We are more than happy to make available a number of resources, the deck of the City of Tomorrow campaign, the video of the City of Tomorrow has been subtitled in a number of languages. We have it in English, we have it in French, we have it in Arabic, in Spanish. So please feel free to use it at your disposal. Also facilitate connections between local civil society organizations. Perhaps you play a key role in gathering a number of organizations that can jointly apply to become part of the challenge. We love when we receive joint applications. That's crucial, that's magic. And we already see the willingness of working together, no, by receiving a collaborative application. Support local civil societies. I mean, sometimes you might need to work with other organizations. It can be the government, it can be the private sector, to gather key information and data that you're gonna need to complete the full application. The first is just an expression of interest. We won't be requiring as much and as detailed information as if you pass the CAT, and that's where the real fun start. And we will be definitely asking very detailed and specific questions. And again, encourage your local civil society organizations to approach the government, to approach the health secretary at all levels, local, regional, even national, and introduce the fact there is an initiative, a global initiative that is already showing results. We're happy to show you and to share with you already success stories that could be scaled and could be replicated as well in your respective cities. Timeline, as already mentioned, everything started back in February, World Cancer Day. In few days, October 21st, that's when the application process officially opens, and where you will be invited to submit an online expression of interest before the deadline, that's December 1st. So you don't have really much time. So please start doing your homework now. If you're really interested, you can even reach out to us or to any of our regional directors. We're happy to put you in touch to ensure that the expression of interest is ready in our inboxes by December 1st. And again, don't panic. Everything is going to be super user-friendly. We will provide you with everything you need to ensure that the application process is as smooth as possible. So first month of next year, 2021, shortlisted candidates will be informed of the fact that they're gonna be able to continue with us in the process, and they will be invited to complete a full application form by 1st of April. So here we're giving you much more time because there's tons of data that you're gonna need to input into the system for us to ensure that then the due diligence process that Rebecca was referring to previously, it's run also as smoothly. Moving forward, we already mentioned 1st of April deadline for the full application. So December 1st, expression of interest, April 1st, 2021, full application of those cities that are invited to submit the full application. And don't worry, if you don't pass the cut this time, there is always gonna be an opportunity, and we can work with you also or find ways to help you improve those aspects that you need to enhance or to advance looking into the next call of application. Due diligence process, which may if COVID allows us, will include on-site visits, although I doubt this is gonna be as easy as it used to be in the past, although past was yesterday. This will happen between April and September 2021. And also the public announcements of successful cities. So that means cities that will join the challenge will be done from May to December 2021. So we will be doing the follow-ups with cities that are not successful in the process, again, because we really want to also start a conversation with those of you that are still willing to join SICAN and to share our vision, but that still are not ready to join the challenge per se. So I hope this encourages you and gives you hope to join us in our journey to the city of tomorrow, today, because we want you to join us today. Maybe you can't be a doer city. Doer cities are the 9 cities that are working with us right now, but there is tons of space to work with dreamers as well. And please, if you have any questions, don't hesitate to drop us a line to both Rebecca and myself. We will be sharing our contact information after the dialogue, and I'm gonna open it up now to questions that hopefully you may have some. I also want to greet colleagues from our cities. If I don't see all of the names of the participants right now, but I'm sure I've seen a number of familiar faces here. And we also want to thank you, UICC, for giving us the opportunity to share our campaign, but not just the campaign, but our work and our vision, no? Because at the end, I think we're all on the same boat, and we are, rolling together to ensure that quality cancer care is accessible to all. So thank you very much for your time and for being here with us today.
So just opening the floor if there is just a question following. Thanks, Beatrice, for guiding us through the city of tomorrow, and Rebecca. Any question from point of clarifications? I wonder if it'd be interesting, well, maybe people are mulling over to hear. I know there are some of our members who are already part of the City Cancer Network, maybe to share a little bit of what their experience was, possibly, what their learning was in their journey. Maybe.
So perhaps, Alessandro, yeah, since we've seen our dear professor from Malaya University here, Rebecca, I think perhaps we can invite her. Sorry, we're putting you on the spot to share how was your experience, because I think it's better if one of the cities share with the audience than us just trying to pass the message. No, I don't know if she's still with us.
Yes, it's
on the line. Yes. Professor Aisha, hello. Sorry, I'm putting you on the spotlight. Welcome.
Hi, everybody. I guess from the Malaysia side, we are very experienced with the application, I guess. We are now at the stage of the formation of the City Executive Committee. I will have to say, the COVID has put a spanner onto a lot of things. And of course, the political picture also in my country right now. So, but we are moving forward. Well, I guess the first steps is actually the application process, which I think on itself was a very good process for different people from different sectors to come together. So it was very interesting getting people from the Ministry of Health, people from the civil society to communicate and work towards a single goal. Because I think in the past, it's always been very difficult, I think, in our country to get the Ministry of Health as well as the civil societies to work together. So I have to report that I guess one of the things that was quite positive is that because of this sort of cross sectoral sort of collaboration, and of course the World Cancer Congress helped a lot in 2018, we are now a bit more engaged in terms of producing our National Cancer Control Policy document. So we are revising, I mean, there will be a new edition starting next year, So we are busy getting that together for 2021 to 2026. So the previous one, I think the engagement was not very effective because a lot of the implementation for cancer control actually depend a lot on the civil society. So I think there was no single goal. People were doing everything in silos. So I suppose World Cancer Congress helped a lot. Doing the City Cancer Challenge helped more collaboration between, especially the academics, the university side, the Ministry of Health, and the civil society side. So I think even that process of application to get into the City Cancer Challenge actually helped that communication between the different sectors. So I think I strongly advise, I mean, if anyone is interested, it's a good way of finding a neutral ground to sort of work together if there's always been a little bit of tensions between the different communities of people at the ministry and so forth. Okay, so I think we don't have much to share, unfortunately. We hope that maybe by next year, we have better idea about what sort of programs that we can actually do in our part of in our country, and to recognize that the cities have all got different needs, may have different level of quality even across the different sectors within each city. So looking forward to seeing how this platform will give us the sort of, the extra thing to bring together everyone to work for a single goal. Okay, I think that's from me.
Thank you, Professor. Another thing that it's really important about the case of Greater Petani in Malaysia now is how civil society team up for a successful city application, no? And this is how the National Cancer Society of Malaysia and the University of Malaya joined forces, no, to submit the application. So even before SICAN landed in their lives, they started working together because of the application process. And that's magic because, see, key partnerships happen even before we arrive, just because we want and we really encourage you to team up with other organizations in your respective cities to submit a joint application. So that was really wonderful to see how the National Cancer Society, together with the university, team up, no, and make the application a success.
Coming from a single organization is very difficult because you don't have enough expertise or resources to pull together. So I think working with National Cancer Society allowed us to really communicate very well because they had a good secretariat, and then the university side, we had a lot of other resources like maybe a bit of more understanding about the processes of cancer treatments and so forth. So it's a good, it was a very synergistic collaboration. And I think when people see two organizations can work together, the others probably have a bit more open to join together.
And perhaps, Rebecca, you can share another example that, and it's the case of Tbilisi, that here it was the association, I don't want to, the Georgia's Pharmaceutical Association and its members, led by Roche, raise awareness about the opportunity of joining SICA to civil society organizations, including the Georgian Patients Union. So you can join forces not only with other civil society organizations, but you can also leverage on your government relations, on industry, because perhaps they can help you to gather part of that data that you require to submit the full application. Again, the expression of interest, that's super simple and easy, but if you are invited to submit a full application, that's when the party really starts. So please, you can also approach the private sector. It doesn't have to be pharma industry only. You can also join forces with other private sector institutions or the government. No, that's a win-win. I mean, civil society organization joining hands with the government, that's perfect, because you see already the willingness from that city to ensure public-private collaboration.
Yeah, I think Rebecca mentioned about the trust issues. So I think that's an important part where, you know, I think in Malaysia, in terms of best practices, sometimes we overdo it, you know, we overdo it in a sense that there's a lot of distrust with the private partnership, you know, like when the industry is involved, conflict of interest, and sometimes it's to the detriment of progress. But I think what is good, I think what City Cancer Challenge has produced this framework where, you know, involvement of the industry will happen later when we have completed the needs assessment, so there's no issues about conflict of interest. So I think that is a wonderful way to demonstrate what the best practices could be. So how, because people want to work together but they're so worried about their policies and conflict of interest, so because there's this nice framework that allow people to cut across and trust each other more. Yeah.
Thank you very much. I see Dr. Heidi Muhammad. Hello, doctor. How are you?
Good, excellent. Thank you so much for the open discussion. And I like the point about always keeping in mind the conflict of interest, and the same time keeping things more, let's say, agile and practical, because sometimes things, those issues put big project on hold just because of this. So that's great that you guys are working on it. But my question is, so I know this, you know, I mean, you guys, I mean, we've been following and reading the City Cancer Challenge. It's an amazing outcome for, and I, you know, and I've been, you know, always want to ask. So I know the application is open for low to middle income countries to participate in the challenge. So my question is, do you guys have, let's, you know, Qatar will not qualify for this, definitely, because Qatar is a high income country. So the question is, do you have at least a checklist for, you know, of things that has to be done and be available in, like in Doha or in cities in Qatar, that I could share with the National Cancer Program here? Make a checklist to review it at the level of Ministry of Public Health, Ministry of Municipality. I mean, anyway, I mean, the last World Innovation Summit of Health that happened in 2018, and here in Doha, one of the biggest discussion was designing and building healthy cities. And the Wish Summit till now, I mean, actually, last month, there was the webinar about continuing the same topic of having healthy cities, building healthy cities. Topic is of interest here in Qatar Foundation and in the here and but I want, if you, I mean, from our perspective as a, let's say, as a cancer geek, you know what I mean? It's from our perspective. If you guys have a checklist, something that beside the application, because I know we don't qualify for that, that I could share in our strategic framework and the Ministry of Health through our membership as Qatar Cancer Society in the program. Thank you.
Thanks for the question. And you know, as Bear mentioned, we do have the checklist. It's very high level though, and it's more around some of the principles that need to be in place, like multi-sectoral collaboration, political will, commitment. But I think it's a good starting point for a conversation. I think, you know, we've had this internal struggle at City Cancer Challenge also, and that is, how do we bring value to cities that are outside of those 9, 12, 15 that we work very closely with hand in hand? And what's the value that we can offer to other cities who may be at a very different point in their cancer care journey, as you've mentioned, in Qatar, where things are perhaps at a slightly different level, where there's still always room for improvement, we know that. And one of the things that we're starting to do now that we have the experience behind us of these 7 cities, is starting to capitalize on some of that knowledge and best practices and lessons learned, particularly in the areas where we see that there are common trends. So I mentioned pathology, radiotherapy, multidisciplinary care. These are things that, regardless of the city, of the income level, they're all issues that are being flagged by cities as critical. And they're areas where we're starting to work very closely with a group of partners to create guidelines, protocols, training packages. And what we're doing now is trying to convert those into knowledge products that can be shared outside of the CCAN family. So I think that my response there is to be patient with us. We'll share what we can now, but know that what we're doing over the next couple of months is trying to take that knowledge that we've learned in those 9 cities with over 100 health professionals validating them, so that we can share those with other cities, such as those in Qatar.
Yeah, I mean, that's great. I mean, this is you hit on the spot. I mean, it's what I'm looking for is quality assurance document that we could take. We'll go back and tell them, okay, we have this area need to let's benchmark it against this, and let's find the area that we need, because as you mentioned, I mean, there is always room for improvement, and there is no one perfect.
Yeah, exactly. Thank you.
Just checking if there is any other question from our friends at CCAN to understand the problem. We just got just a couple of minutes left, so in case there was anybody else who wanted to address any particular issue.
In the meantime, Alessandro, if I may, I have shared a number of documents through the chat. One of the documents is the City of Tomorrow Social Media Toolkit. So it's been designed both in English and Spanish. And please help us to spread the word, share everything you want with your network. You have pre-drafted messages, visuals from videos, stills, etc., ready to be used for you. So please ensure you read it, you use it, and that it's very well shared with your network, because that would definitely help us to ensure that our voice reached a very quality audience. The more cities, the better, no? If they want to, definitely, even if they are high income level cities like Dr. Heidi Muhammad has mentioned, there's always room for improvement. So we are all together in this boat. As we said at the beginning, cancer touches everyone, no matter where they live. So that's why we really want to join forces with all of you.
Thank you, Beatrice, and thanks for sharing all those tools. That we'll also follow up and share with the participants at the end of the conversations. Well, if there isn't any other question, I'd just like to thank all the participants. Thanks, Rebecca and Beatrice, for joining us. And as you've heard, I think CCAN, in the short time they've been operating, have already built an amazing track record. And as I think has came through from the conversation today, starting even in engaging in the conversation with your local stakeholders will bring value, whether you are successful in your application or not, and there will always be call going forward. So thanks everyone. I hope you'll join our friend at City Cancer Challenge in making your city more cancer ready. And thanks for participating, and have a good rest of the day, everyone.
Thank you. Thanks, everyone. Bye.
Thank you. Bye.
Thank you.
Thank you so much. Bye-bye. Thank you. Ciao, ciao.
We appreciate. Bye-bye. Have a nice day.